So one of the reasons I went into oncology was really for the relationships formed. It's something that I feel is unique to oncology. We see our patients pretty regularly. Some patients maybe as often as once a week because they're going through something that they need to be followed a little bit more closely. And that's not something you see in other, specialties very often. And so, I enjoy that aspect of my practice is the relationships I form with people and, getting them through a tough disease and, to the finish line, or if there's somebody that's going to be on chemotherapy for a long term, helping them through each step of the process and, as things change. That is a very rewarding aspect of my practice. I started thinking about medicine at a young age. My dad was diagnosed with a type of lymphoma when I was pretty young, and so I spent a lot of my early childhood visiting the doctor with him in the hospital, and that's really was my early exposure to medicine. He actually ended up passing away from his lymphoma. It was unfortunately prior to some of our newer treatments that we have, but I watched my mom go on after that, and she decided to become a nurse, and she was a single mom and went back to nursing school, and I remember sitting in study groups with her and her friends, and I was just really interested in the anatomy of things and how the human body worked, and that kind of pushed me to start thinking about medicine. And once I started medical school and was kind of looking at what other specialties I might be interested in, I kept being drawn to oncology. And I think a lot of that had to do with my early experience with my father and the relationship that he had with his oncologist. And so that's kind of how I ended up in the direction that I'm in now.